Hi guys, welcome to the Rachel MADDOW news. Let's listen what news Rachel brings to us today.
The Rachel Maddow Show, weeknights at 9 Eastern on MSNBC.
Rachel's off tonight. She will be back on Monday. What a week it's been. This has been one of the wildest weeks in American politics in recent memory, and we're going to get to that tonight. It's been an exceptionally wild week on Wall Street as well, and we'll get to that too. But just before we came on air tonight, the president announced via tweet that he's ousting his chief of staff, Mick Mulvaney, and replacing him with the far-right Congressman Mark Meadows, who is a staunch Trump ally. We're going to have more on that as well in a moment. But let's start tonight with the latest on the coronavirus outbreak, which continued to spread around the country and around the world today. There have been 15 deaths in the United States from coronavirus, 14 in Washington state, 1 in California, and there are 326 confirmed cases nationwide. The states of Oklahoma, Kentucky, Minnesota, Indiana, Connecticut, and Nebraska reported their first cases of the virus today, which means that more than half the states in the country now have confirmed cases. New York's governor announced today that his state now has 44 confirmed cases, with 5 of them sick enough to be hospitalized, and about 4,000 people in quarantine and being monitored for symptoms. Fallout from the epidemic continued around the country as well. In Washington state, where there are now 58 confirmed cases in the Seattle area, that's the country's worst outbreak, the University of Washington canceled in-person classes today for its 50,000 students until at least the end of the month. Johns Hopkins University announced that the men's college basketball tournament there this weekend will be held without spectators. So there will be some very quiet games this weekend. The city of Austin, Texas, canceled the giant South by Southwest festival, which was slated for next week. Lufthansa, the giant German airline that employs more people than any other airline, plans to cancel half of all of its flights. In terms of how this virus continues to spread, AIPAC, the influential pro-Israeli lobbying group, announced this evening that 2 New Yorkers who attended its big annual conference this week have tested positive, which is especially concerning because the AIPAC conference is a who's who of the American political establishment, particularly the Republican establishment. For instance, Mike Pence, Vice President Pence, was one of the speakers there this week. And speaking of the vice president, he held a press conference with federal health officials this evening and offered a few updates. First, on the matter of this cruise ship carrying thousands of passengers that is being held off the California coast ever since a passenger on the ship's previous journey tested positive for coronavirus and died this week in California, with 20 people on board showing symptoms, coronavirus tests were, watching it here, they were helicoptered to the ship and then flown to a lab for testing. Vice President Pence announcing this evening that 46 people on the ship were swabbed, 21 of them tested positive, including 19 crew members, a fact that the people on the ship reportedly learned about by watching Mike Pence on television. Pence also said that the ship will come into port and that everyone on board will be tested. But officials say they're still trying to figure out where that would happen. They're looking at several military installations in California as possible testing sites. But here's the thing. In order to test people, you need tests. In order to test thousands of people, like the thousands on that cruise ship, you need thousands of tests. And there seems to be some confusion in the Trump administration about how many tests they have and how many tests will be available when and who will be able to get one. In fact, earlier this week, the White House said there would be 1 million tests available by the end of the week, as in today. Then yesterday, the administration said it was going to miss that goal by more than 900,000, having only 75,000 tests available by the end of the week. Then this evening, the vice president announced that the government will have shipped 1 million tests to various labs as of tomorrow, and then there will be more shipped out possibly early next week. But no one should worry because definitely tests will broadly be available to most Americans in a matter of weeks, which seems kind of long at this point in time. The Atlantic magazine today reported that, quote, through interviews with dozens of public health officials and a survey of local data from across the country, we could only verify that 1,895 people have been tested for coronavirus in the United States. Local officials can still test only several thousand people a day, not the tens or hundreds of thousands indicated by the White House's promises. And Time magazine reports today that this apparently sluggish response to the virus's spread in the United States may be the result of months of wishful thinking by the White House. Quote, since January, epidemiologists, former U.S. public health officials, and experts have been warning that the administration's insistence that containment was and should remain the primary way to confront an emerging infectious disease was a grave mistake. They warned that the unique features of this flu-like virus made it impossible to control and that the administration must use any time that containment measures might buy to prepare the country for an inevitable outbreak. The administration was using all of its resources to blockade the doors, they warned, but the enemy was likely already in the house. I mean, today, several public health and disaster response experts from Johns Hopkins University went to Capitol Hill to brief congressional staff on the epidemic. This is what they sounded like.
Do you think the testing capacity is adequate in the U.S., and do hospitals with labs have access to everything they need to either package up and send or perform the tests?
Thank you for that question. I think the short answer is no. Testing capacity is not currently adequate, and we need more. We need this as soon as we can have it.
Having more appropriate testing will ultimately lead to greater public calm. In a setting in which we know that testing was rolled out quickly and adequately and to a large number of people, we saw numbers of total cases that were having severe disease and or subsequent death decline significantly. Clear, consistent, trusted messaging is extremely important.
So we very much do not have enough tests. And what we need more than anything right now is more testing, as well as clear, consistent, trusted messaging. Well, how's that going?
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test. If there's a doctor that wants to test, if there's somebody coming off a ship, like the big monster ship that's out there right now, which, again, that's a big decision. They would like to have the people come off. I'd rather have the people stay, but I'd go with them. I told them to make the final decision. I would rather, because I like the numbers being where they are. I don't need to have the numbers double because of one ship. That wasn't our fault. As of the time I left the plane with you, we had 240 cases. That's at least what was on a very fine network known as Fox News. I told Mike not to be complimentary of the governor because that governor is a snake, okay? Inslee. And I said, if you're nice to him, he will take advantage. And I would have said no. Let me just tell you, we have a lot of problems with the governor. And the governor of Washington, that's where you have many of your problems, okay?
A couple things interesting there. I'd like to see the numbers where they are. I don't need them to double. I don't need the numbers to double because of a ship that's not our fault. And the governor of Washington State is a snake. But put that aside for a second. According to the president of the United States, anyone in America who wants a test can get one yesterday. Also, he would like to keep a few thousand people stranded on the cruise ship off the coast of California because he's worried that them touching American soil would make our numbers look worse in terms of the number of cases. And as he said, that's not our fault. Oh, by the way, the president gets his numbers from watching Fox News, even though he's literally standing next to his two top health officials. He quoted Fox News when stating the numbers, even though the two people he counts on are next to him. The governor of Washington, dealing with 13 deaths and the worst coronavirus outbreak in the country. He's a bad guy. He's doing a terrible job. He's a snake. Clear, consistent, trusted messaging. Joining us now, Thomas Boyke, director of the Global Health Program at the Council on Foreign Relations. He's the author of Plagues and the Paradox of Progress, Why the World is Getting Healthier in Worrisome Ways. Mr. Boyke, thank you for joining us. You and I spoke last week, and you emphasized what I've just emphasized, and that more testing is probably the most important thing right now. More accurate testing. We're not clear on where we stand with testing. According to the president, everyone who wants a test can get a test. We seem to have information that suggests otherwise.
That's right. So what we have seen to date from the U.S. government on testing is the exact opposite of what you want to see in an outbreak. We are overpromising and under-delivering. As you mentioned, we had the promise coming from the federal government was that we would see 1 million tests this week. At best, we have seen 75,000. And as you've mentioned, there's no indication and some media reports that it may be many fewer than that. We have absolutely no idea what the real number of infected people are and where they are. And this is a huge problem because, of course, the countries that have successfully dealt with this outbreak, forget China. Think of Singapore. Singapore had community spread. They tested every severe case of pneumonia they had to try to identify people, and they found some cases with that. They implemented social distancing policies to keep other people from getting sick. And most importantly, they did this with great speed, and that is not how we've operated.
Thomas, let's talk about this. We've discussed, the point in determining the spread of an epidemic is not actually to test 100% of people, right? What does effective testing look like? And then what is this conversation that we're having about containment? The president keeps talking about how great it was that we stopped people from coming in from China. But a lot of health experts say, actually, you have to think about this differently.
That's right. So, of course, we can't test everyone. You want to test people that have symptoms that might be indicative of somebody that has this disease. So, again, in the Singapore case, that meant testing patients with severe pneumonia. They tested them all, and that was something that they had done with great speed in that instance. In this case, it may be we don't have tests, so it may be starting to test people for flu, starting to test people so we can exclude the possibility that they might have coronavirus. So that would be the way to go. Look, for communities that could still possibly have containment, it is worth trying to contain cases to the extent possible. But it is clear, as you mentioned, 25 states have cases. At least 91 countries have cases. The idea that we would confine this to a small number of countries or a small number of cases in a small number of states is past us now.
Thomas, you study this a lot. You know a lot about it. What would you do if you got up in the morning and you felt like you had a cold or you started coughing? How would you think about this?
Great. So on the individual level, it is everything that I'm sure your audience has heard before, which is, of course, if you feel sick, stay home. If you need to seek medical advice or you may think you have the condition, call. Do not go in person to a healthcare facility. Stay home. Call in to get that information and get advice. The CDC website has excellent information for people out there. Of course, for the people that aren't feeling sick, it's still washing your hands, coughing into your elbow. Again, keeping distance from people that are visibly ill. For communities, I'm sorry.
Go ahead, Thomas.
No, for communities, really what we need to see is we need to see them surge their capacity safer. So it's going to be really important that we protect health workers here. Our response to this outbreak is going to depend on keeping doctors and nurses safe. That means not buying masks unless you're sick. But that also means for residential care facilities, because these affect the elderly disproportionately, and for hospitals, they need to start planning in advance.
Thomas, you set it up nicely because I'm going to be speaking momentarily to the Associate Director of Nursing Practice at National Nurses United to discuss the healthcare side of things and the healthcare workers. Thomas, good to see you again. Thank you. Thomas Boyke is the Director of the Global Health Program at the Council on Foreign Relations and the author of Plagues and the Paradox of Progress, Why the World is Getting Healthier in Worrisome Ways. Thanks for your help in continuing to understand this for us. As we said earlier, the Trump administration keeps promising that more coronavirus tests are coming. Donald Trump himself says that anyone who wants a test can get one right now. But if you want one stark example of how untrue that is and how behind the government appears to be on the testing front, take the case of one nurse in Northern California who is quarantined because she became sick after caring for a coronavirus patient. In a statement released by her union, the nurse says, quote, "I'm awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered it." The national CDC would not initiate testing. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of our health in this country, end quote. She says she is now essentially on a waiting list for a test. Quote, delaying this test puts the whole community at risk. Nurses aren't going to stand by and let this testing delay continue. We are going to stand together to make sure we can protect our patients by being protected ourselves, end quote. With me now is Michelle Mahan, the Associate Director of Nursing Practice at National Nurses United. That is the country's largest nurses union, which released that statement from the quarantine nurse. Ms. Mahan, thank you for joining us. We appreciate your time tonight.
Hi, I'm glad to be here.
Talk to me about, first of all, the situation about this quarantine nurse. It sounds amazing. I read what we know, and I think to regular people who are not health professionals, they'd say, that's amazing, right? This nurse knows she was in touch with somebody with coronavirus and then started showing symptoms and can't get the test. I mean, if anybody should be getting a test, she should be getting a test.
That's right. That's right. I mean, as your previous guest said, it's really important that we are taking care of healthcare workers right now.
Yeah, you are at the front. You're the tip of the spear, really, for us. And there is a discussion about people who've been buying masks and things that healthcare workers need and not having enough for healthcare workers. Where are you on this? What is your sense of how well-equipped nurses, who are the front line of all medical care in this country, are? How well-equipped are you to confront this?
Well, nurses don't have the things that they need on the front lines. We conducted a survey of over 6,000 nurses in every state, 48 states across the country, and only 30% of nurses say that they have the supplies that they need to safely care for their patients.
About 40,
it's just not happening.
If I'm not mistaken, somewhere about 44% of your respondents said that they've had some communication from their employers, which might be a hospital or clinic, about a plan to confront coronavirus. But more than 50% said they hadn't had the communication of a plan, let alone the idea that they know what that plan is.
That's right. And that's just alarming. These are the kinds of preparations that hospitals and health systems should be doing routinely. This shouldn't be a surprise. The whole key of everything in healthcare is about being prepared, about knowing what to do, about having plans in place, performing drills, and being ready. And in this case in particular, with this coronavirus, we've had weeks and weeks where we should have been preparing for the imminent arrival in the United States.
I want to just read you another paragraph from the quarantine nurses statement. I'm appalled at the level of bureaucracy that's preventing nurses from getting tested. That is a healthcare decision my doctor and my county health department agree with. Delaying the test puts the whole community at risk. And I think the point she's trying to make is if you take frontline workers off at this moment, you are risking the health of all Americans.
Absolutely. The most important thing that can be done right now is to increase the standards of protection. And unfortunately, what we're seeing is that the CDC is putting out guidance that walks back the protection. The most important thing that we can do is control and keep our healthcare workforce safe and in service. Nurses want to take care of patients. Mm-hmm. In fact, the nurse that we have in quarantine was a volunteer on a special team who made this arrangement just so that she could provide this care. Nurses are ready to go. And unfortunately, what we're seeing is even after the very first exposures at UC Davis, which got a lot of press, we're still seeing that hospitals across the country aren't doing what they need. So it's really alarming, and it needs to change immediately.
Well, we're deeply indebted to you and your fellow members of your profession for wanting to be on the front lines. Most people run the other direction, and you are looking to have your coworkers ready to help the rest of us in the hour that we need. Thank you, Michelle. Michelle Mahan is the Associate Director of Nursing Practice at National Nurses United. We appreciate your time.
Thank you.
Much more to get to tonight. Up next, the president appoints a fourth chief of staff. And later, the sense that something is amiss among many Democrats after Elizabeth Warren drops out of the presidential race. We've got a lot to get to tonight. Stay with us.
Hey, everyone. It's Tremaine Lee, MSNBC correspondent and host of the new podcast, Into America. In our latest episode, Republican giant and longtime Senator Lindsey Graham is for the first time ever facing a real challenge to his Senate seat. Can a relative newcomer to the scene, a black Democrat in a red state, win this fight? I head to South Carolina to find out. Search for Into America wherever you're listening right now and subscribe.
We just want to be treated fairly.
There's like a lot of shooting happening.
I don't care what he says. He's not getting my vote.
Hi, everyone. It's Tremaine Lee, MSNBC correspondent and host of a new podcast, Into America, featuring the journalist of NBC News. It's a show about politics, about policy, and about the power that both have in shaping the lives of the American people.
The roller coaster is not any easier to stomach now than it was 2 years ago.
Each week, we're going into America to tell voter stories.
He's doing the best he can for the country.
Because we're incarcerated doesn't mean that we should lose our right to vote.
You can find new episodes of Into America in your feed every Thursday. To subscribe, search Into America wherever you're listening right now.
As we mentioned tonight, the president has canned his third White House chief of staff. The president announced in a set of tweets that he is going to replace outgoing chief of staff Mick Mulvaney, who has served in that role for just over a year, with Mark Meadows, a North Carolina congressman and staunch ally of the president during his recent impeachment trial. Why the president chose to dump Mulvaney now, as the administration battles a spiraling coronavirus outbreak that has now claimed 15 lives in the United States, remains unclear. Also unclear at this hour is who will take over as the head of the Office of Management and Budget, where Mulvaney had continued as the director. But his exit was not unexpected. As chief of staff, Mulvaney never managed to shed his acting title, and he was largely sidelined after falling out of favor with the president last year. In December, a Republican close to the White House described his role this way, quote, "He is there. I'll leave it at that. He's like a kid. His role at the dinner table is to be seen and not heard." Well, one of the few times Mulvaney was heard was when he admitted in front of a worldwide television audience that, yes, the White House had conditioned a meeting for the president of Ukraine on an announcement of investigations that were politically advantageous to Trump. That shock admission was followed by Mulvaney telling the American public to, quote, "get over it." While Mulvaney will now assume the plum title of Special Envoy to Northern Ireland, his position will be filled by Mark Meadows, the four-term North Carolina lawmaker who's cast himself as one of the president's most aggressive defenders in Congress, announced that he would not run for re-election this November, while hinting that he might serve in some future role in the administration or the president's re-election campaign. The future, apparently, begins now. Joining us now, Phil Rucker, White House bureau chief for The Washington Post. He's also the co-author with Carol Leonnig of A Very Stable Genius, Donald Trump's Testing of America. Phil Rucker, good to see you. Thank you for being with us, sir.
Thank you, Ali. Good to be with you.
Phil, what do you make of this? Mark Meadows, the president has treated the position of chief of staff very differently than his predecessors. The chief of staff was at one point the most powerful position in America. That has not been the case for at least two of the last three of the president's chief of staff. And arguably with John Kelly wasn't all that powerful either. But the bottom line is the president has diminished the role. So what do you make of this decision?
Well, it's been a long time coming and rumored for many months. The president has tired of Mick Mulvaney. He wanted Mulvaney to stay in this job throughout the impeachment proceedings and the impeachment trial. Remember, Mulvaney was a key figure in all of that in terms of his role in helping withhold that aid from Ukraine. That said, once the impeachment trial was over and the president was acquitted, he felt like he had a green light to go ahead and make some of the staffing changes he wanted to make, and he wanted Mulvaney out. Mark Meadows has long had the president's ear and arguably has been more influential in guiding the president the last several months than Mulvaney from the outside. Meadows is a real political animal and seen as somebody who's going to really have an eye towards the re-election campaign as he leads the government over the next 8 months.
He's an affable fellow. He's very friendly, but their backgrounds are similar. They're both Southern congressmen who were Tea Party, Freedom Caucus, fiscal hawks, constitutionalists.
That's right. And you don't have to go back that far, frankly, to the Obama years when Meadows was a real fringe figure in the Congress among the House Republicans. He was a rabble-rouser, the head of the House Freedom Caucus. He was that thorn in the side of Speaker John Boehner. But with the Trump presidency and Trump's ascendancy in Washington, Meadows got on board that train pretty quickly, became the president's top defender or one of the top defenders in Capitol Hill, a major presence on Fox News and in conservative media, and has really carved out an enormous amount of influence with the president.
Do you make anything of the timing? There are some, if you don't follow this too closely, you might say, well, look, there's this coronavirus thing, and the White House is not handling it particularly well. Are they bringing this guy in to handle it, or is this a Friday night distraction, or is it something else?
Well, one timing thing that is noteworthy, apparently Trump offered the job, this has been reported by the New York Times on Thursday evening, and did not announce it, of course, until tonight, after the markets closed on Friday for the weekend. So clearly Trump was trying to not have a story of turmoil and shakeup in his West Wing while the markets were still open. So that's notable. You know, it could be some sort of an effort to distract from the coronavirus problem. I don't know. It's not clear that Mark Meadows is going to be able to do anything to resolve this crisis that Mick Mulvaney couldn't do. Meadows is not an expert in infectious diseases or public health crises. That's something that, they have Mike Pence in charge of, the vice president, and of course, all of the experts in the various scientific and health departments.
Most people who've studied White House chiefs of staff have sort of marked the erosion since the beginning of the Trump administration in the power of that role. Do you think that changes under Meadows? Do you think he'll sort of resurrect the role a little bit, or is that job what it is?
I think the trajectory continues. You had in Reince Priebus and John Kelly, the first two chiefs of staff, figures who tried to some degree to be guardrails against the president, to try to steer his course of action, to prevent the president from following through on his more reckless and dangerous impulses. And then you had in Mick Mulvaney an enabler, a chief of staff who saw his job much more as trying to answer the president with a yes, to follow the president's orders, do what the president wanted done, not get in the way, not say no as often as Kelly and Priebus did. And I suspect Meadows is probably going to be more in the Mulvaney mold than the Priebus and Kelly mold. Yeah, one of the things that Trump and Meadows have in common is in 2012, Meadows made a comment about sending Obama back to Kenya. He subsequently said there's no racist bone in his body, but he got associated with the birther moment. I'd like to point out from time to time, Phil Rucker, I don't know if you've been around when I've said that, I'm actually from Kenya. So that's a topic close to my heart. Good to see you, my friend. Phil Rucker is the White House bureau chief for the Washington Post. Thank you for your reporting tonight. Much more to come tonight, including that the highest, hardest glass ceiling still remains firmly in place. Stay with us. Before Hillary Clinton, before Shirley Chisholm, there was Margaret Chase Smith. She was a Republican senator from Maine, and she was the first woman in history to serve in both the U.S. House and the Senate. Margaret Chase Smith was elected to Congress in 1940, first to fill the seat left vacant by her husband's death, and then on her own merits. In January of 1964, Margaret Chase Smith announced that she would run for president. She became the first woman in this country to run in a major party primary for president. Now, take a look at this. This is a Universal newsreel from 1964 when she announced her campaign. Look at how they titled the segment. Because Margaret Chase Smith was a woman, they called it Bonnet in the Ring, not Hat in the Ring. Bonnet. Okay, roll the tape.
Senator Margaret Chase Smith of Maine makes the announcement that she will seek the Republican presidential nomination.
Because of these very impelling reasons, against my running, I have decided that I shall.
Her announcement was greeted with laughter, and that was just the beginning.
Where will your Washington headquarters be, or where shall you begin to receive campaign contributions?
The chairman of the Republican National Committee says his office will be headquarters for the campaign contributions.
Will you be willing to debate Rocky and Barry and Harold in New Hampshire? Who will be your running mate?
None of the announced candidates have indicated any desire.
What would you do as a candidate to break down discrimination against women?
Well, if the people of this country don't know what I would do from what I have done, I don't think that I could add any information to that.
Senator, if you can't make it yourself, which candidate would you support for president? Goldwater, Rockefeller, Nixon, Scranton, or who else? Well, again, I must answer that I'm a candidate for president, and I'm not supporting anybody else.
Margaret Chase Smith never got past the first ballot at the Republican convention. More than 50 years later, we saw the exit yesterday of the last competitive woman left in the Democratic field, Senator Elizabeth Warren, suspending her campaign following the departures of Kirsten Gillibrand, Kamala Harris, and Amy Klobuchar. Tulsi Gabbard is still running, but for all intents, the race for the White House is down to two white men in their 70s vying to challenge another white man in his 70s. We're past the point where people laugh when a woman says she wants to be president. But if we're not there anymore, where are we now? Joining us now, Maria Teresa Kumar, President and CEO of Voto Latino. Ms. Kumar, thank you for joining us tonight. What are your thoughts on this? We have had a woman win the nomination of the Democratic Party, run for president, get more votes than the current president, and then we've had several women vie for the nomination this time around. What's your sense of where we are?
Let's remind the American people that the last time a woman headed the Democratic nomination of a major party, she won. Hillary Clinton won 3 million more votes than Trump. And now that we're seeing a lot of this other evidence of whether or not he won fair and square, that leaves it for us to remind ourselves that anything is possible in America. The fact that 4 women came up right after her and said that they were going to run, and they were prosecutors, they were senators, they demonstrate our possibility. And I think sometimes what happens with the American people is that we get a little bit shy of actually breaking the glass ceiling. Mm-hmm. But let's not forget, Ali, the reason that the Democrats won the House last midterm was because Women's Fury decided not only we're going to run for office. And I sit on the board of Emily's List. Let me give you an idea. In 2016, 600 women decided that they were going to run for office through Emily's List. After the president's inauguration, 43,000 women decided that they were going to run for some sort of office, whether it was today, tomorrow, or last year. And that tells us that we're creating a pipeline of diversity of thought. When you look at go toe-to-toe on the policies, it was women who had the most exceptional policies when it came onto that debate stage. And so what we have to remember is that it can't, yes, there's, what's the saying, 1 step forward and 2 steps back. That's exactly what we saw. But the women that are leading the charge, the ones that are holding strong to our Constitution, that making sure that we are following the rules, have been led by women. I'm thinking of Speaker Pelosi. I'm thinking of the young women that are now on the progressive side of the Democratic Party, encouraging people to think broader and bigger. So this is not a we cannot do it. It's a matter of what is the trust that the American people can remember within themselves, because we have already elected a woman president. Let's do that again.
Let me ask you about the criticisms about why Elizabeth Warren didn't win. Some people maybe just didn't like her policies. Others said that there was some degree of sexism or different treatment because she was a woman and the way she put out her policies. Some people have called it misogynistic. What do you think's true?
I think it's a mix of all of it, right? We had a national poll where she was actually number 4, and she didn't even appear on that national poll towards the end. I think that there was a huge misstep in Iowa because she never got the gravitas that she came out number 3 in the Iowa caucuses, but it was because of that Iowa caucus debacle. It was almost as if it was a perfect storm. There was also a big body of the Democratic Party that funds a lot of electoral campaigns that were quite afraid of her. They didn't want to fund her for what she represented, and that was making sure that everybody paid their fair share into society so that we could actually have a functioning government. So there was a lot of factors, but she was brave, and she showed us how we have to think big once again. I have to tell you that when I would listen to Elizabeth Warren, she was reminding people that we had already done and made these hard choices of making sure that we would close the gap on income inequity. We did this 100 years ago, and she was reminding us that we needed to do that refresh.
So here's the question. I get the whole issue of the pipeline and the number of women who have run and the idea that there will be more women hopefully running each time. But at some point, when you compare apples to apples, Elizabeth Warren did have a plan for everything. She did have a policy for everything. She outlined the policy for everything. She put it out there like a scientist would put it out in a journal to be evaluated by their peers. She got criticism for her plans and her price tags on things. At what point do we as voters need more from a woman candidate?
I would say that, look, I would actually equivocate. It wasn't that we needed more from a woman candidate. I think it was more of what the times were calling for. Just as she had a plan for everything, so did Al Gore. And we had trouble with that. And I think our challenge is really saying, who right now, when people were casting a ballot, was like, who could actually beat Donald Trump? I would actually argue that this election has little to do with policy and everything about making sure that we change the White House. And that's what voters were going in from. And that maybe she was ahead of her times. But it's a very different election. Had Elizabeth Warren perhaps run in 2012 or 2000, in any other time when people were looking for real solutions because it was the economy stupid, she may have had an easier path. Right now, the majority of people casting a ballot was like, how do we make sure that we replace Donald Trump? For good or worse, I would actually argue that folks aren't actually not looking for big ideas. They're looking for making sure to retain the course of some sort of normalcy when it comes to our democracy.
Maria Teresa Kumar, always a pleasure to talk to you. Thank you for joining us. Maria Teresa Kumar is the president and CEO of Voto Latino. Coming up, the aftershocks from Super Tuesday are still reverberating. What Warren supporters and Bloomberg's dollars mean for 2020. That's next.
Hey, it's MSNBC's Chris Hayes. This week on my podcast, Why Is This Happening? I'll be talking with Enes Kanter, an NBA star who has been exiled from his native Turkey due to his religious beliefs.
The Turkish government sent police to my house in Turkey, and they took every electronics away, phones away, computers away, laptops away. They raided the whole house and they took every electronics away. They wanted to see if I am still in contact with my family or not.
That's this week on Why Is This Happening? Search Why Is This Happening wherever you're listening right now and subscribe.
It is, of course, Friday everywhere, but out on the West Coast, it's also still Super Tuesday. Results continue to trickle in from California's Democratic primary election. Right now, Bernie Sanders leads Joe Biden by about 273,000 votes statewide. Now, in the national delegate count, Joe Biden continues to lead Bernie Sanders by 68 delegates, making him the national frontrunner. That's before we've got all the numbers in from California. But all eyes are focused right now on another candidate who is no longer in the race, Senator Elizabeth Warren, who ended her campaign yesterday and has yet to indicate whether or whom she plans to endorse. Last night, Senator Warren sat down with Rachel on this show to talk about her presidential campaign, the narrowing field, and a major development in the election for which she takes credit.
Senator, you outlasted Mike Bloomberg in this campaign.
Oh, yeah. Was he still in that race?
He was still in that race, but nobody could tell after you destroyed him on the debate stage that way. A lot of postmortems on his campaign credit you, basically, with single-handedly tanking his candidacy with the way you took him apart in that debate. Do you, is that what you were trying to do?
Yes.
Do you take credit?
Sure.
Elizabeth Warren made short work of that question. Yes, she was trying to end Mike Bloomberg's candidacy when she went after him in the Las Vegas debate, and it worked. He tanked on Super Tuesday. Now another 6 states will vote this coming Tuesday in a sort of a mini Super Tuesday. Wonder what will happen then. Joining us now, David Plouffe, former campaign manager and senior aide to Barack Obama, President Barack Obama. He's also an MSNBC contributor and the author of a new book, A Citizen's Guide to Beating Donald Trump. Mr. Plouffe, thank you for joining us tonight. Elizabeth Warren's out of the race. Short of her endorsing someone, Morning Consult suggests that her supporters would be split almost evenly between Joe Biden and Bernie Sanders. Does that make sense to you? Is that about right?
It does. I mean, I think there was a conventional wisdom that they would skew heavily Sanders. But if you look, Joe Biden did extraordinarily well on Super Tuesday in a lot of suburban areas where Elizabeth Warren also had strength. Biden has the momentum now. He looks like he could win. He's still got a lot of work to do. So I think for those reasons, it probably will split. I think those that, and Bloomberg didn't do well on Super Tuesday, as you pointed out, but he still got a lot of votes. And so if you split the Warren vote roughly 50-50, let's say, and give Biden maybe 75% of Bloomberg, that is going to give him, I think, a pretty advantageous position heading into both March 10th, the state you just showed. But we have massive states on March 17th, like Illinois, Florida, Ohio, and Arizona.
She sort of picked a lane, and it seemed to be a lane that was occupied mostly by Bernie Sanders. But in fact, you know Elizabeth Warren, and you know her history. She could actually fit comfortably into either lane. She could compete. She could have competed with Joe Biden. She could have competed with Bernie Sanders. If you were advising her about whether she should endorse someone, what would you suggest she do?
It's such a personal decision, Allie. So I think we see that her supporters are probably relatively balanced. She probably wants to see how the next couple weeks go, take some time to figure out what her role is going to be going forward. So, other candidates made a decision to endorse. This is the right decision for her. Like picking a vice president, whoever our nominee is, that's the most personal decision they make. Whether you endorse or not, it's a very personal decision. But looking at those numbers, maybe if 90% of her supporters are going one way or the other, that might tip the scales. But her people are relatively divided. And listen, there's a chance this race maybe not be formally over. Mm-hmm. But if Joe Biden does as well as on the next two Tuesdays as he did on Super Tuesday, his delegate lead's really going to grow.
Yeah. So, in fact, Bernie Sanders was supposed to have a rally in Mississippi. He instead went to Michigan. He won Michigan very narrowly last time around. Joe Biden is polling very strongly in a lot of states. For this Tuesday, looks like it's Joe Biden's to lose more than it's Bernie Sanders to win.
Well, you mentioned Mississippi, so I'm going to nerd out on delegates a little bit like I like to do.
I love that.
If Joe Biden's going to win Mississippi, probably by a large margin, Bernie Sanders skipping his event probably gives some clue of that from their side, too. So, Mississippi, if I recall, has got 36 delegates. Mm-hmm. I mean, Biden could net 25 or 30 out of that state alone. So that's important. So let's say Michigan is close. Bernie wins it by a few. Biden wins it by a few. Roughly split delegates. Same thing with Missouri. Now, I think Bernie Sanders might do quite well in North Dakota and win some delegates, but it's a really small state. So then you've got to look at the 17th. I mean, there was a poll yesterday showing Bernie Sanders not viable in Florida. Now, I actually believe by the time the vote happens, I think he's going to get above 15%. But if he's losing Florida by 50 or 60 points, Joe Biden will net 200 out of that alone.
Let's talk about the states that are voting on Tuesday. You mentioned a few of them. There'll be Mississippi, there'll be Montana, there'll be North Dakota, there'll be Michigan, there'll be Idaho, there'll be Washington State. What are you looking for on Tuesday night?
Well, first of all, does Biden maximize his delegate yield out of Mississippi? If he does there like he did in other southern states last Tuesday, he will. In Michigan, even though I think the delegate situation will be relatively balanced, given that Bernie won it last time, if Biden's able to win that, I think it shows his momentum continues. Same thing with Missouri, a state that was super close with Clinton and Sanders. If Biden wins there, I think it says a lot. And then can Bernie, so last time, Washington State, Sanders just clobbered Clinton there, but it was a caucus. So I still think it's a good state for Bernie Sanders. Right. But in a primary, what kind of margin can he build there? Because he's now behind in the delegates.
It's a mail-in and hand in your ballot type of primary now. So that'll be interesting because Washington is really suffering from coronavirus. There was some concern about how that's going to work. But in fact, it's the one state that can continue with its primary regardless. Right. David, good to see you. Thank you for joining us.
Thanks, Ali.
Former Obama campaign manager David Plouffe, author of the new book, A Citizen's Guide to Beating Donald Trump. All right, up next, a federal judge cries foul over Attorney General Bill Barr's handling of the Mueller report. More ahead. Stay with us. As Rachel likes to say, programming note, she will be back in this chair on Monday, and joining her will be the governor of Washington State, the state at the heart of the current coronavirus outbreak. Governor Jay Inslee has seen 14 of his state's citizens die after contracting the new strain of coronavirus, and in the meantime, he's incurred the wrath of President Trump for criticizing the federal government's messaging about the crisis. Today at the Centers for Disease Control and Prevention, the president took the time to insult the governor, calling him a, quote, snake. He will be here Monday night with his latest on the state's response to coronavirus. Don't miss it. And that does it for me tonight.
The Rachel Maddow Show, weeknights at 9 Eastern on MSNBC.
My views about coronavirus. As you all know, nowadays it's become a biggest problem for world community. Each and every country trying to get sort out of this problem. First, we need to know how this virus spread all over the world. Some rumors say it's separate from China fish market, or some say it is late chemical from Chinese lab. But now it's not important how it's separate from where or somewhere not. But it is important to stop. How to stop it? Till today, more than 3,000 people already died in all over the world, and thousands of people already suffering from this disease. They are infected with this virus. Country like China, Iran and Italy has most number of dead people. Now I am coming to what is corona. It is a virus which shifted one to another human body very quickly. After enter the human bodies, human feel sick, like they have symptoms like fever, cough and difficult to breathe. To save ourselves from this disease, we don't need to panic very much. Instead, we need to have some precaution like someone has fever, then he should consult his doctor first, and if doctor suggests, then go to the lab and have corona test. If someone has cough, he should stay at the home, and if someone has cough near you, you should stay away from that people at least 3 feet, and if necessary, then go out of the country. To protect ourselves, we should avoid the handshake each other, and we should wash our hand with soap at least for 20 seconds. Avoid touching face with unwashed hand. Coronavirus symptoms is like ordinary fever. No one can realize the virus enter his body because it's become serious after 14 days. The person who is infected with this virus, he can't breathe properly. Currently, there is no vaccine for this virus, but some research say the death ratio in this virus not very high. So you can say out of 100, 3 or 4 people can be die. So we don't think like this virus that if someone has infected, he would be died. If doctor consult the virus first stage, then they can control it. Hopefully soon we will find the solution of this disease, and we can make any kind of vaccine for this disease. So I would suggest you don't believe on rumors, and just you have to precaution, and hopefully everything will be fine very soon. Thanks.